I've been interested and involved in major trauma reconstruction and soft tissue reconstruction ever since I started training as a doctor. It's very much head to toe. You know, one day I'll be reconstructing a scalp, next day reconstructing a leg, and that can be soft tissue, so skin, fat, fascia. But it's often involved not just trauma, but also cancer work. So reconstructing any soft tissue defect around the body, and that's kind of the area that I'm interested in, the area that I've been working in. Microsurgery in general ticks a lot of the boxes that plastic surgeons have, in the sense that it's quite meticulous. You have to be quite methodical and careful. You know, I'm using a microscope and stitching with sutures that are thinner than the human hair. And so the blood vessels that I'm having to connect under a microscope are sometimes 1 millimeter in diameter. And so it appeals to all of those senses that a plastic surgeon has, and the, you know, attention to detail and tiny methodical approach to reconstructing both form and the way something looks, but also function. I'm constantly looking for the new technology to stepwise improve that quality of care that we can offer. I guess some of the other technology that we've used are the modern microscopes, which are remote. You don't have to look down the scopes anymore. You can look through 3D glasses and the scope can move around the patient. And also robotic arms to do your microsurgery. So one of the uses for that is if you're stitching vessels that are 1 millimeter in diameter, every time you move your fingers or your arm, you know, under a scope at 40 times magnification, that's going to move quite a lot, and just breathing moves the arm under the scope. And so by using a robot that can counteract those tiny micro movements, you're able to stitch vessels even smaller. And that's quite useful when it comes to lymphatic surgery.